Hello everyone, this is Dr. Aaron Seaton with the Chiropractic Place. Today our video is about a sacroiliac sprain strain. This is the most common injury that I see with people in their low back when they're having low back pain, that they've strained their low back, and that's kind of the common terminology that they'll use. Typically, they lifted something too heavy or improperly. Possibly they were gardening a lot that weekend. There's a lot of different causes for it, but those are pretty common. So usually the patient will show up kind of holding like one side of their pelvis like this, and we see them kind of pushed forward and away from the side of pain. So if you have pain on your left side, it'll kind of push you forward and to the right. So that's what we call an antalgic lean that we see with people who have this kind of injury. Usually the pain is on one side. This pain can radiate. Typically the pain can radiate up into the lower ribs. It can also kind of come into the buttock area. That's the real classic signs of sacroiliac sprain strain. And like I said, most common thing that we see causing low back pain. There are some things that people typically do that can kind of irritate this. So there are two things that I tell my patients when we see this, and it's kind of in that acute phase. It's pretty new. The first few days, I tell them, try not to do a bunch of stretching and try not to do a bunch of massage or myofascial muscle work. And I find that this is really a really common response for a lot of patients who have this problem, is they start trying to stretch it a ton, they start trying to work on the muscles a bunch, and it'll flare it up even more in the beginning. So I try to describe this to patients so it makes sense when you're having low back pain like this. Think of it like you just got a cut on your finger, and that cut just healed. And you start going and pulling on it and rubbing on it. What's going to happen to that cut? Well, that cut is probably going to open up. It's probably going to get worse. It's probably going to take longer to heal. So I tell patients, try to think of it when you have a strain like this in your low back, like you would a cut on your finger. You're not trying to move it a ton. You're not trying to stretch it. Just kind of leave it alone for a couple of days, kind of let it heal up. And then the two things I would recommend in this is to put some ice on there to help kind of keep the inflammation down and kind of regulate it a little, but also getting an adjustment, because a chiropractic adjustment is going to restore proper motion to that joint without causing a ton of stress to that strain that like deep tissue massage can do, or trying to overstretch it. But usually after the first 3 to 5 days or so, you're okay doing those things like massage and stretching, but it's that first 5 days that you kind of want to leave it alone with that. So, but best treatment for this is get that adjusted by your chiropractor. Hopefully, if it's us, come and see us, get that adjusted. Usually these last anywhere from 7 to 14 days if there's no crazy complications with them. They do clear up, but you want to get the motion in there with your adjustments to keep it healing and get it to heal faster. And then after that, obviously, anytime we have patients who come in with this, we take digital x-rays of their low back to understand if there's any underlying causes for that, so that we can better help them and serve them in the future. If you have any questions regarding this, give our office a call. I'm Dr. Aaron Seaton with the Chiropractic Place.